I start with every talk with the kind of the same thing I say. Like my goal is threefold. One, to make you guys realize why medicine is truly the best career choice that you can choose. Two, why it's possibly the worst career choice you could choose. And three, really being confused and being in that gray area. And I'd love for everyone to get into that gray area and really see, wait, do I really want to do medicine? What do I like about it? What do I not like about it? What are the things that excite me? How do I get more involved? How do I distance myself from the field if need be? How do you kind of approach that, right? And I think when you're in that gray area, there's so much growth involved, so that if you do end up choosing to become a doctor, you're gonna have a whole new, fresh set of perspective. So kind of the way I'm gonna talk about all these questions that are lined up, we're really gonna have this kind of higher arching principle of living your life to its fullest and becoming the best version of yourself.
Awesome. Thank you so much. So can you first provide us with an introduction about yourself, what PM&R is, and why you chose it?
Absolutely. So again, my name is Dr. Darsh. That's what I go by on social media. I'm currently an intern. So I'm a first year resident at Penn State Hershey doing physical medicine and rehab, but my first year is an intern year. So it's pretty much like internal medicine. What is physical medicine and rehab, right? It's a question I get so many times because it's not something a lot of people get exposed to, even medical students. So I even have current residents that work with me that are like, Darsh, I have no idea what you do. And I'm like, that's all right. I don't even fully know, because it's so hard to really delve into the field unless you get exposure. So physical medicine and rehab. So let's break down the physical medicine part, right? So physical medicine meaning musculoskeletal system as well as the neuro system. So kind of like the superficial nerves, how it relates to pain, back pain, all these different kinds of ailments. And then you have the rehab side of things, which is like you see in the TV show, how do we get people to start walking? You see those commercials of people with prosthetics and amputations. That's exactly what we deal with. So the beauty of PM&R is that there's inpatient and there's outpatient. So inpatient, you can do things like spinal cord injury, brain injury, stroke rehab, and just general rehab. And then outpatient, you can do things like interventional spine, you can do sports medicine, you can do regenerative medicine, which is what I'm thinking of doing. And then you can also do things like cancer rehab, movement disorder. There's just so many different things you can do. So the reason I really chose the field is, one, the patients are just super motivating. I think, you get to work with patients who a lot of times didn't ask for their injuries. A lot of times they didn't ask for this gunshot wound to the back, or they fell down a flight of stairs and now they kind of broke their back. And you're with them, rehabbing them through this process. So you're with them for a while. It's not a one and done kind of interaction. And so you're pretty much holding their hand, and you're not only their doctor, but you're also their life coach, you're their mentor, you're more than just a doctor to them. And so you really take them through this up and down journey of them to optimize their life. So that's like the main reason, I think, is just the motivating patient population I'd be working with. And then some other things too is you can really curate your own field with PM&R. So I'm very interested in doing ultrasound. I'm very interested in musculoskeletal pain. I'm very interested in integrative and functional medicine. So I can combine all those different things. So I can get a little hands-on and do procedures in OMM, but then I can also do clinic, but then I can also do academic medicine. So there's so many different things that you can do with it, and you don't really get pigeonholed into one thing with PM&R.
That's awesome. So is there any other specialty that really appealed to you during your rotations?
Yeah, so I actually chose PM&R as a third year, like when I was in my third year of medical school, because again, I didn't have much exposure to it. So prior to that, I was always interested in going to GI and internal medicine. And the reason why is I look at kind of the way I want to practice. And again, I'm very into functional medicine, which is like root cause analysis. So I think the main issue here with Western medicine is that we focus too much on treating symptoms, but not what the root cause of that ailment is. And so when you treat symptoms, sure, the patient feels better, but are they truly actually better? No, because their symptoms are going to manifest again. They're going to come back to the hospital. So with GI, there's this huge explosion, I'm sure, as you guys know, with the gut microbiome and all the research that's coming out behind it, and how, the gut-brain connection, 80% of your immune system's in the gut. And so I was fascinated by GI for that reason. And so that's initially what I wanted to do, but the reason I didn't pursue it was because of having to do internal medicine as a residency. And I just didn't really vibe with it. I'm not a big fan, again, of that acute presentation of symptoms. I'd rather be someone who can really understand the patient, be more on the outpatient side, dig deep into their history, and really cure them of these ailments rather than just taking care of symptoms. So GI was my first love, I'd say, but then transitioned to PM&R.
So given the diversity of specialties, how do you pick the best fit for you?
It's a good question. So I think the first step that everyone goes through is, do you want to do surgery or do you want a non-surgical field? or are you looking for something in the middle? And so surgical feels obvious, right? Surgery, plastics, those head ortho, all those things. But then the ones in the middle are the ones like, what are those? That could be like OB-GYN, could be ophthalmology, ENT. Those are the ones that really come to mind. Radiology as well, in case you want to do interventional radiology. And then you have the clinic side of things, right? The internal medicine, the non-surgical stuff. So that's really what you choose first. After you choose that, so for me, I knew I did not want to do surgery. If it was somebody with back pain and standing up and just a lifestyle, it's not what I wanted. So I ended up choosing clinic, and then I said, what do I honestly enjoy? Do I want to be on call? That's where you start to look at money. You start to look at lifestyle factors. You start to look at, are you going to be able to do some procedures? So those are really the things you look at from there. And for me, physical medicine rehab, again, was probably the best in terms of lifestyle. You're not on call. I'm able to do outpatient if I want to. I can be hands-on. And yeah, I think the compensation is great for it. It's a really hot field. So because of that, those reasons, I chose PM&R. And it first starts with choosing clinical or non-surgical versus surgical.
So building off of that, what does a typical week look like for you? Like how many hours are you typically working?
Yeah, so it definitely depends on the rotation that you're in. So common misconception I think that a lot of people think is when you're a resident, your whole year is the same. But as a resident, you're just a glorified medical student. So you're still going through rotations, albeit your rotations are more tailored towards what you're going to be doing, right? Like I'm not doing emergency medicine for a month. I'm not doing OB-GYN for a month. I'm not doing surgery for a month. Everything I'm doing right now is internal medicine related for a month. So now it really depends on what the rotation is. For example, right now I'm on outpatient and my life is super chill. It's like I went in today at I went in at 1, I came back at 4. My patient didn't even show up. But then if I'm on so that, that would be like a 9 to 5 kind of thing. If I'm on the inpatient wards, let's say I'm on ICU, I'm working close to 85, 90 hours a week. You're getting there around 5:36 in the morning where there's sign off or sign out. So you get all your patient information. Then you go pre-round. So you by yourself go and see all your patients, take notes, see what happened overnight. You look at the labs, you look at, is there anything we need to fix up right now? And then you start to write your notes, and then right about 8 o'clock in the morning, 9 o'clock, depending on the attending, you go round with the whole team. And so you go patient to patient, you discuss the case, you discuss what you want to do for that day, you put in the orders. That usually ends around 11:30 noonish most days. So then if you pretty much from there on out, it's you get your lunch, you finish up your notes, you finish up your orders. And then if you're the team on call, so usually here at Penn State, we're on call every 3 days. If you're on call, you're taking in admissions. So you can get up to 3, 4 admissions. So these are new patients where you're doing a whole history and physical from scratch. And they're basically just gonna be a new patient on your team. But if you're not on call, then you're essentially just there just tidying up any loose ends and things. But you're easily pulling off 12, 14, 15-hour days on your harder rotations. But I think if you talk about hours, I'd say you're anywhere from probably 60 to 85 hours, depending on the rotation. And it's 6 days out of 7. So that's the other thing. Yeah.
Okay. Wow. So when things get too overwhelming, what are some of your coping mechanisms?
Yeah. So I'm very into living my life and my side passions, not only focusing on medicine, but also having a life outside. And when I was a first year medical student at BCom, one of my professors told me, a doctor is not who you are, it's what you do. And it's so true. And I think so many people, as pre-meds, high schoolers, once you're in medical school, once you're on this pre-med track, I think we too often engross ourselves in it instead of taking a step back and saying hey, the end game is not being a doctor. The end game is, living your life with happiness and passion, and being a doctor is one of those things that supplements that. But you have to have all these other things supplementing as well. So coping for me I love to read. We've got a whole bookshelf right there. Working out for me is the one thing I have to do every day that just makes my next 24 hours great, right? So a lot of people talk about having a morning routine or meditation, all these things, which, I do tend to have here and there, but I always urge people, find that one thing every day that if you do, no matter what disaster, whatever it is that can attack you or come your way, you're going to be okay because you complete that one thing. And for me, that's definitely fitness and getting workout in. So I would say that's kind of my coping. It's funny you asked that because I actually got this question earlier on a DM on Instagram asking me, hey, what do I do to kind of cope with burnout? I do not let myself get to the point of burnout. I'm not one of those people where I will push myself, and then I'll need a reset. Every day for me is I'm living right below that burnout, just because I never want to get there. I don't think it's a fun place to be.
Can you talk a little bit about your fitness journey and your podcast and everything else that you have going on?
Yeah, so man, so I'm super entrepreneurial in my mind. So I'm always looking for ways of kind of building value and creating value. So I just recently started a podcast called Optimize Your Life. And I tell you, it's not a medical podcast. It's a podcast where I'm just interviewing people who have showed some sort of excellence in their industry or field and wake up with, you know, a renewed sense of passion every day and look to optimize their life so that they can become better human beings. So I do have doctors on there. I have business people on there. I have life coaches. I have other entrepreneurs on there as well. So essentially each episode, and it's through an IG Live. So if you guys do follow me, you guys may have seen it. They are on my IGTV, but it's also on Spotify and Apple. It's called Optimize Your Life. And pretty much my goal is for when people hear it to start to incorporate things in their life. You know, I always say it's about becoming better by 1% every day. And if you can become 1% once a week, I send out a newsletter just kind of highlighting the tips, tricks, and the experiments I'm using in my life so that I can live better. So things about sleep, diet, fitness. I have something called like the pre-med corner where I'll give some advice to pre-meds as well. So you guys know kind of what to focus on in your journey and kind of live the best pre-med life without so much stress. So those are kind of the two projects I'm working on right now. And then you mentioned fitness journey. So again, like PM&R fitness, they kind of go hand in hand. So I've been an athlete growing up my whole life. And so fitness for me has just been the one staple that raises my confidence, my self-image, just everything about it. So yeah.
So kind of shifting gears, can you talk a little bit about your undergrad experiences, the Mcat, and how the medical school admissions process went for you?
Yeah, it went terribly for me. I'll start out with that. So I was actually in a 7 or 8 year medical program, like a BSMD. I was at Temple University's BSMD program. So, you know, did well in high school, got into that. And I was actually started as I actually was a pre-dental 7-year student. And then after my first semester, I realized like, hey, I don't want just an oral cavity approach. I want a full body approach, exercise physiology, things like that. So I asked to transfer and they said, yeah, that's fine. So I transferred after my first semester into the 7-year BSMD. And so I actually didn't make it through, right? You realize like, you're a DO, right? So I didn't make it through. So I missed the GPA cutoff by 0.02. It was a 3.5 GPA that you need in a 30 MCAT. So 30 MCAT is about a 508 now. So I reached the 30 MCAT. I got that right on the dot. The GPA was where I missed it by 0.02. So, you know, I'm going through every semester saying, okay, I'm going to get a 4.0 this semester. I'm going to do this semester. And the problem was I didn't know how to study. Like Temple University, there was no homework. And I realized the reason I did so well in high school was because I got homework and I was reinforcing the things I need to learn through homework. When you get to college, I don't know how Wayne State does it, you know, but at least at Temple, there's no homework. It's kind of like, hey, go learn this on your own. We'll lecture you. Here's an exam in 2 weeks, right? I just could never figure out what worked for me. And then I was also just probably interested in other like social aspects and social things that I didn't put forth all my energy into just studying. But that being said, I'm just super happy I didn't get accepted because I had to end up taking 2 gap years. So I applied for a total of 3 times. After my junior year, didn't get in, got some interviews. Second time I applied, actually got less interviews, didn't get in, but I got waitlisted by BCom. And the great thing about BCom is if you get waitlisted, you're pretty much guaranteed the next cycle to get in without an interview. And so that's what happened. So that third time I applied again, but I got that one acceptance from BCom. But again, those gap years were everything. And I tell people this all the time, like if gap years were a company and like I would be a billionaire because all I do is promote gap years as to why they're so important. If you look at the average age of a medical student right now, right? Or a first year medical student, it's about 24 and a half, 25. Now I'm like, me thinking of going into medicine out of a 7-year program at the age of 21 is scary. I look back at it now and I'm like, I was not mature enough. And I don't think any 21 or 22-year-old has the mental capacity and clarity to understand what medicine truly is. Because a lot of people don't realize that medical school is very different than undergrad. Whatever worked for you studying in undergrad isn't necessarily going to work in med school. And med school itself is not school anymore. It's your career. So the issue that I've seen is a lot of undergrads that go straight through, they treat it like school. they care a lot about the GPA or the grades and the exam, but you have to realize it's not school anymore. This is where burnout, comes. This is where you have to realize that understanding the material is more important than just getting great grades. Your boards, you have to really prioritize certain things, and you only get that with growth through your 20s. You naturally just grow more and more, just like a better version of yourself from when you're 22 to 24 to 26. And I guarantee you, if you guys look back at yourself 5 years ago, you would be like, wow, I don't know why that kid was thinking this. I don't know why the mentality of myself was that. But there's such a huge growing and a growth spurt that occurs in your 20s. And so I really recommend people to take advantage of that before you go into med school, because it'll make your life so much easier once you go to med school. Once you had those couple of years off to really think like, hey, is medicine really for me? And if it is, then awesome, you're pursuing it. But then you can also take the time to travel. You can take the time to get work experience, get paid employment, do research, focus on yourself, and really figure out those side hobbies and side passions before going into medical school. I see a question right here saying, what did you do in your gap year? So perfect time, we'll just go through that. So I did 3 things. The first thing I did was medical scribing, right? So that's super popular now. It actually wasn't, I'm 28. So that was about 7 years ago. Wasn't that big then. So I was a pediatric emergency medicine scribe at CHOP. So I did that for about 9 months. And then I was a virology lab technician for a pharmaceutical outsourcing company. So kind of cell culturing, lab rat kind of stuff. Did that for about 9 months. And then I ended up doing research at UPenn. That was cancer rehab research. And I did that essentially for about 10 months. And then on the side, I also did I drove Lyft. I got to travel to Spain, France, Italy, and did a backpacking trip there. So I got a great, great experience. I delved into different interests. I saw what I liked, but then I also had fun in my gap year too.
So someone in the chat asked if you ever considered going into physical therapy and how similar the PT program is to PM&R.
Yeah, so funny enough, it's funny, because PT, PA, occupational therapy, nurse practitioner, these are all things that are starting to blow up now, because I think people realize how honestly messed up hospital, being a physician can be based off how much politics and administration there is, and just a lot of it's not fun because of that. So I think a lot of people take that route, and say, hey, I'll take the less pay, but I'll be happy if I don't have the burnout and stuff. So personally, no, I never really considered PT. I didn't consider any of those healthcare specialties. My backup plan was actually either go to St. George's for medical school. If I didn't get it to the States, I did get accepted there, or do a master's in exercise physiology. So yeah, it's funny that you mentioned that, because I've never even thought that. I'd never considered it. So yeah, I didn't. And how similar is it PT to PM&R? It's different, because PT only focuses on MSK. It doesn't focus on medications. It doesn't focus on medical management, right? So a PM&R doc, you're medically optimizing and managing patients, right? So if somebody comes with a spinal cord injury, of course they need physical therapy, occupational therapy, speech therapy, but who's going to take care of them if they can't control their urine, or they can't control their bowel movements, or they have nerve pain coming, right? So that's where PM&R doctors come in. We know the medicine, we know the treatments, and we also suggest to physical therapists what type of treatments need to be done.
So kind of touching upon something you just stated earlier, what are some negative aspects of medicine that you have encountered?
Yeah. So, man, where does it start? It's a whole cycle. So let's start with where you guys are at, right? So I'm pretty sure 99% of medical advisors are just terrible, right? And should not be doing their job, because one, they didn't get into medical, right? The whole process, so many advisors tell us, don't apply, I don't think you're cut out, all this bull crap, right? So first and foremost, don't listen to anyone that says, hey, you're not cut out for this, or your GPA is not good enough, or blah, 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 blah. I know plenty of people who had below 3.5s, below 506, 508 Mcats, that still thrived and did well. But sometimes it takes to do with those gap years, right? So I think that's one thing that's wrong with the system. Our mentoring process or our coaching process early on is not realistic. I think the ability for advisors to tell somebody at 20 and say, hey, maybe we need to wait a little bit till you mature a little. Sure, that's a way better advice than just saying, hey, I don't think you're cut out, right? So I think we need better reinforcement. The other thing is residency programs are on the decline, right? But med schools are opening up at a faster rate than ever. So what we're seeing now is that, hey, you can get into a medical school, but your chances of matching, sure, they're high, but there are some people who go into massive debt and don't match because there's no programs or there's no spots available for them. So I think that's like a really big like issue. The other thing is the discrepancy between rural medicine and urban suburban medicine and healthcare access. Now, I'm sure a lot of you guys have done research into like healthcare disparities, healthcare access. A lot of your essays might even be written about them. It's a terrible issue. Other issue is how much medications we actually just prescribe for no reason at all, and how much of our system is not personalized, right? So we always talk about evidence-based medicine or evidence-based research, but a lot of people don't realize that all this research falls under a bell curve. So what you're essentially doing for the patient is just saying, hey, this medication worked for like 60% of people, it should work for you, right? So there's this lack of personalized medicine, but I think you can only really get that outpatient. But the more personalized you get, the less health insurance will actually cover those things. And so what ends up happening is only the rich can get the best type of healthcare. That should really be for everyone. Other things is the ACGME and like burnout and like how much money a resident makes is like terrible. I'm honestly only seeing half the money that I like probably should be making. So with each resident going to a hospital, there's about like 112 or 110, like 150,000 maybe that go with that resident to each program. But I'm only making 60,000 out of that like 150. So, there's that discrepancy, there's burnout. I'm pretty much making minimum wage if you really count out my hours. So that's another thing. And then just business administration, politics, like doctors, honestly, I don't think a lot of people realize, but you're almost like a puppet many times. And it's tough for you to make your own choices because you have an overseeing kind of faculty that's looking down on you. So those are just a few of the things. And there's a reason why more than 50% of physicians are burnt out. And there's a reason why so many physicians, you guys may have encountered this, where you ask them, hey, would you do this again? So many of them say no, because again, if you look at the generation right now, the people who are saying no, they wouldn't do medicine, think about when they chose to want to go into medicine. There was no gap years back then. There was nothing. You were 20, 21, and they went straight into medical school, not realizing, hey, is medicine truly what I want to do? So a lot of these people realize, man, I chose it too early. I should have waited. I should have taken 2-3 gap years. But they didn't get that chance to do it. So those are just a few of the things. There's a lot more, I think, out there.
So someone in the chat asked, what's the most important pre-med class for med school?
No, none of them. There's nothing as a pre-med will help you with med school. I don't mean that in like a terrifying way because med school is like hard. I mean that like undergrad's very useless. Like if I could go back, I would have been a non-science major. I would have done like philosophy or world history. And I urge you guys all to do the same. If you're not too deep into your major, if you're a freshman or sophomore, change your major ASAP to like something where you can just enjoy and have fun like with it. Literally, college is the last time in your life where you can just delve deep into another field. And what's awesome about it is that if you choose not to do medicine, well, cool, at least you have like a different background. But if you're a biology major, for instance, and you're like, man, I really don't want to do this healthcare thing, well, what's the real job potential with a bio major, right? There's not much that you can do besides like go into research and stuff. So it can limit you in that sense. But I just think there's so much more upside choosing a major that's non-science, because even if you do end up choosing medicine, now you have a whole new fresh perspective. Like I wish I did business too. Like I could maybe start a business right now, maybe be more entrepreneurial, learn the stock market, learn how to incorporate hospital business administration or outpatient stuff with what I currently am trying to do. So I just think that the possibilities are more endless with doing a non-science major. Because honestly, none of it's going to help you on the Mcat, I feel. Like Temple was terrible with their science. It didn't help at all. For the Mcat, I kind of self-studied. And none of it, honestly, okay, I'll say anatomy and physio kind of helped. But even then, you're going to at such a different level,
So how often do patients surprise you, or how frequently do you come across something you're really unfamiliar with?
Yeah, so patients can definitely surprise you in a lot of ways, right? So one of them can be like drug-seeking behavior, right? So a lot of times when you see a patient who's on opioids or all these things, they are always frequent flyers to the emergency room. You're gonna write them off and say, oh man, this person's here for pain meds. So it actually just happened to me the other day where we had this patient where we thought he was coming for pain meds, but surprised us and actually had a small bowel obstruction. But nobody took him seriously, and it was just insane, like how much we as doctors have our biases many times, and how we have to let those biases go and let every patient be a different patient, right? Every patient is different. Just because you've seen patterns doesn't mean that, oh, because this one patient fits this pattern, it's got to be whatever that pattern was. No, it could be something completely different. So you have to treat every single patient the way that they should be treated, that person. If you really want to talk about personalized medicine, that's the first approach to it. Something I am unfamiliar with. Yeah, so because I'm at Penn State Hershey, which is like a level 1 trauma, it's pretty much a hospital that like runs central PA. We get a lot of cool cases. I do see maybe like once every 2 weeks, I'll see something that's like, whoa, like I've never even learned about this. So we actually had a patient with Lay syndrome. It's like 1 out of 6. He's 1 out of 6 living with it. He's the older survivor. It's a mitochondrial disorder. Never heard of it in my life. But it's one of our patients. So just like, you know, that's something cool that you don't get to see every day. But you're also seeing like crazy trauma stuff too. So people after surgery, because we're at Penn State and because we have all the resources here, a lot of those sicker patients do come to us. So yeah, I'd say the more level 1 hospital you go to, more academic, you're going to see those like crazier things versus going to like a hospital that's very small. You're going to see more of your bread and butter cases there.
So was there a specific patient interaction that you had that really piqued your interest to become a doctor?
Yeah, so I think like I was always interested in medicine at a very young age, probably like 2nd, 3rd grade. I don't know why. I just always loved the sciences. I just thought my value was in healthcare. But I do remember like writing my personal statement on this interaction where I was shadowing ENT at University of Pittsburgh Medical Center. I walked in the room and this doctor that I'm shadowing says, hey, like great news, we eradicated your tongue cancer, stuff like that. And she just like starts crying and she says, thank you, doctor. And then she turns to me. And at the moment, I'm actually wearing a long white coat that my cousin gave me because he just, you know, he didn't want anyone to think I was somebody else, but I was part of the healthcare team in shadowing. And so the woman looks at me too and goes, thank you, doctor. And I've never like felt such a heartfelt thank you. And it's funny because 2 weeks ago when I was rotating on GI, the attending said like medicine is the one field where you will get a thank you every single day. And it's so true. Like the patients are honestly very grateful. You really feel like you're adding value. But I do like, that is the one, I think, interaction that I was part of where I was like, wow, like I could definitely wake up and do this every day.
That's awesome. Somebody in the chat asked what specialties actually consider the holistic approach of treating patients.
Yeah, none of them. That's the problem with Western medicine. Absolutely none of them. You can do the holistic approach with any specialty, even surgery, because you're going to see your patients post-surgery. And so you can still focus on holistic kind of stuff. As much as like DO schools are like, oh, we have this philosophy of like mind, body, spirit. Sure, but how much of it's really getting taught? Like not really any of it. I don't remember, like I didn't come out of school being like, yeah, I'm all about mind, body, spirit. That wasn't instilled in me, you know, through school. So honestly, none of the specialties just incorporate it. I think PM&R, you can do it the most because of alternative medicine and the biohacking and more of like the newer technologies, I think are more incorporated into physical medicine rehab. So that's another reason why I chose it. It's such an easy transition from PM&R and using PM&R, but then also incorporating those holistic integrated functional medicine.
So can you discuss the difference between DO and MD? I know there's a lot of misconceptions with that.
Yeah, so, you know, common thing is a lot of people think DOs cannot do what MDs do. And that's what people have come up to tell me and say, oh, you know, you can't do surgery. And I'm like, what do you mean I can't do surgery? So a DO and MD, essentially, for what you guys want to know, they can do everything the exact same, every specialty, anything, right? The only difference is that DOs do about 250, 300 hours of something called osteopathic manipulative medicine, OMM for short. And that's essentially, we learn how to use our hands to treat and diagnose different like internal ailments, MSK ailments, neuro ailments, a whole bunch of different things. So essentially, I'm like a glorified chiropractor or something, right? Like, you know, a lot of people say it's like an MD plus having a chiropractor kind of mindset. I can crack backs, I can get rid of headaches, like tension headaches by massaging, I can release fascia, I can do a lot of these different things. So that's honestly the only difference, is that DOs have just this extra training with OMM. Now for me, that's awesome because one, you can bill for it, you can make money off of it. It also, two, it helps patients become more compliant. Sometimes they don't need medication, they just need OMM. And it allows these patients to come back to you every so often So it increases that compliance. And then the other thing is it's more holistic. There's less side effects to it. So that's essentially why I think OMM is amazing. Other differences that I would say is certain specialties will have more MDs than they will DOs. For example, like plastic surgery, dermatology, it's harder to get into as a DO. So most DOs actually go into your primary care specialties, so like family medicine, pediatrics, internal medicine. I'd say about like 65%, I think, like DOs actually, or I would say, I forget what the stat was, I think 65% of like internal medicine doctors are DOs. So that's essentially the main difference. If you want to go into one of those like higher, more competitive fields with higher board scores, MD is probably the better choice for that, because again, you just have that MD behind your name, and that's what these programs are looking for.
So since there's such a common misconception between the difference, have you ever had a patient treat you differently just because you're a DO?
Yeah, so I think the bias really is non-existent in the hospital. Like, I've not come across that. My MD colleagues don't look at me like less because I'm a DO. I've actually, honestly, the whole biases are like non-existent in healthcare, even with patients. So many patients, oh, I love my DO. That's my family doctor's a DO. So I really haven't heard or seen much of those biases, actually.
Okay, that's awesome. So kind of shifting gears a little bit, do you have any advice on choosing the best medical school for you?
Yeah, so let me start by saying there is no such thing as a bad medical school. All right, so a lot of people are like, oh, I want to go to Harvard or Columbia, but they end up getting into, I don't know, like a third tier medical school, ranked 100 and something. In the end, it really does not matter. You can go into any specialty that you want from whatever medical school you're in. Now, I don't know how much of that's really going to change, because as you guys may have heard, step one, the first board exam, is going towards pass fail. And so what a lot of people think now is, hey, maybe they're going to rely more on legacy and more on name and prestige than they are on, other factors, because what other factor is there really that you can use as a metric to really gauge students, especially if it's becoming pass fail. So what I would recommend, though, is don't be afraid to apply everywhere, right? Like, don't try to just be in one location. That was my biggest mistake when I applied those first 2 cycles. I'm from Philly. I was trying to stay in the Northeast. Northeast is the most competitive for all of academia. So it didn't make sense, and I had to start applying out, which I slowly did. I started applying more south, more west. So don't be afraid to apply all over. You can always have a preference if you do end up getting at one of those schools that are closer. Then the other thing, honestly, is like, just figure out the vibe and the culture of that place, just by talking to other students who have gone there. So definitely just go on Instagram, see if you can find any students that attend that school, and just message them and see what the vibe and the culture is. And ask them to be honest. Ask them what the downside of the school is, because every school will have some sort of issue. Every medical student loves to complain. It's inherent. So you got to figure out what are those things, and are they really red flags or are they not red flags? But again, there's no such thing as a bad medical school. If you can get into one, you have made it. The hardest part of the whole journey is getting into medical school. After that, you're going to be fine.
Are there things that you wish you knew before pursuing this profession?
Yeah, I wish I knew to take a gap year before going into undergrad. I wish I knew not to apply to a BSMD program. I wish I kind of just did a traditional four-year route, do a different major. I wish somebody told me that nothing you learn is really going to help you for med school or becoming a physician. You might as well delve into your interest in some other field. But I think the gap year was huge, because that way I could have planned out an extra year, an extra 2 years, and not stress so much. I could have taken my Mcat later. I could have not been worrying so much about research and just focusing on my GPA, because I knew I could do research in my gap years. So things like that, honestly, I think, yeah, I wish somebody told me about the myths of school, right? Like no one told me the average age of a first year medical student is like 25. That's something I found out once I turned 25. So yeah, there's a lot of things I wish people were just more honest about.
Someone in the chat said, can you recommend a resource that maps out how to specialize within different fields? For example, it's not clear to me when you should do a residency in pediatrics and then follow up with a fellowship in oncology versus anesthesia residency, then peds fellowship.
Yeah, that's a good question. So I don't know if there's any resource that can like help you out with that. There is a book that I remember. It's called it's called the Match something. It's like a big, thick red book. Tells you like about each specialty. There are books out there that tell you about specialties, characteristics, what you need to do. But in terms of that, whatever residency you go into will be your base knowledge, right? So here you're saying, okay, residency in peds and then fellowship in hemonc, right? So you're pretty much going to be a pediatric oncologist at that point, but you're primarily going to be a pediatrician, and then you're going to know some cancer stuff to add on top of it. Versus if you did hemonc, now you're definitely an oncologist, but now your fellowship is learning about kids. So you're going to sprinkle in a little bit of more of that, learning about kids and using kids in your practice. So it really depends. I would honestly reach out to people in those residencies or in those fellowships, because it can definitely become very confusing. And it also depends on the program and the fellowship. Some fellowships are very procedure heavy, some aren't. Some will have different rotations that, have a special clinic that you're actually interested in, but some of the programs won't have that. So it's a very gray area. And what I would focus on, honestly, is more of the type of doctor you want to be. Like, again, clinical versus surgical. And if you choose the clinical route, figuring out those things based off lifestyle, money, burnout, all that stuff. But yeah, it's definitely a tough question. I don't know how to answer that because it's so different.
Someone said, does where you go for medical school play a big role in where you do your residency / your chance of being accepted at a certain hospital?
So I would say currently, no. That's definitely a myth. Your medical school does not matter at all for when you apply to residency. It's more about your board scores, and like it's like applying pre-med and going to med school. It's the same thing for med school and residency. Your CV and everything matter, your letters of recommendation, your personal statement. However, again, with step one becoming pass fail, I don't know. There's no way of knowing until after that, those first 2 years kind of happen where it becomes pass fail, and then we can see the trends in terms of does med school matter or not. So I can't give you a definite answer until we find out, in the next 2-3 years.
Do you think the pass-fail policy starting this year for step ones will benefit or harm medical students?
I think it will harm more than anything. So the reason they said they're doing it is to reduce burnout. I think this actually increases stress now, especially for DOs or international students. Sure, like it's now a pass-fail, so all I have to do is pass. But now they're thinking step 2 is going to be more the metric that you have to focus on. And you take step 2 usually at the end of your 3rd year. And before, 3rd year was, it wasn't easy, but it wasn't tough because it was just like outpatient, you still got a life, you're done with board studying. But now you have a whole another year where you really have to hit the books again. So I think it actually just increases stress. What I would propose, honestly, is doing a tier system where if your score is in a certain like range of like a 270 or above, you're tier 1. If you're 250 to 269, tier 2. If you're 230 to 249, we're at tier 3, and you kind of go down that way. Because that way you're not fighting for a specific number, because oftentimes what you will see is resident study for a specific number. If you want to get into ophthalmology, you have to hit a 240. If you want internal medicine, you need that 230. If you want to do ortho, you need 250 plus. But when you do that tier system, sure, you're reaching for a goal, but sometimes getting those 5 points from like a 235 to a 240 is really tough. But if you know you fall within that bracket, that is what's going to reduce burnout and stress. So yeah, sure, you still have to aim for a score, but you're not aiming for a particular score. So that's what I thought they should have done. They didn't. A lot of people think it's money driven. Could be. I mean, the medical field is all about making money. So who knows?
Yeah, my sister is in medical school right now, and she feels the exact same way.
Yeah.
Can you break down what medical school was like the study schedule and extracurriculars?
Yeah, so it depends where you go again. DO schools usually are mandatory classes. So like for VCOM, we had to go to at least 80% of our classes. That I did not like because I can just two-speed a lecture online. And so and the lectures are still recorded online. So I would honestly go to like class, I'd study another subject because whatever I was learning in that class, whoever was teaching, I was going to get tested on that for like another month. So I focused on what like I was going to be tested on, in the next week. At VCOM, we did block scheduling. So what that means is each year we had 4 blocks, and each block would be a different organ system. So block 1 for us was actually just like biochem, the basics, microbiology, immunology. Block 2 was MSK. Block 3 was cardio. Block 4 was neurology. Block 5, GI, reproductive system, and you kind of keep going on. I like that way better because within each block, you're learning everything about the heart, right? So you're learning the pharmacy, the microbiology, the pathophys, the anatomy, all of it. And we do anatomy with each block. So when we're in cardio block, our anatomy dissection is on the heart only. We're not worried about all these other things. So I think some schools, they will just do anatomy like for the first 12 weeks, which I think is tough because if you don't have a global perspective about what you're learning, it's very tough to put all that information in your head. So that's the way VCOM did it. And then what I would do honestly is I would focus, every day I woke up, I focused more on first things I need to accomplish was not studying. I made sure not to study first thing in the morning. And the reason why is in the first 2-3 hours of the day, your willpower gets used up actually. So if I put all my willpower towards studying, whenever I got done studying, I would be complacent and say, okay, well, I'm done for the day. But then what just happened to my like workout? What happened to my run? What happened to me reading like the book I wanted to read? What happened to me growing as a person aside from just medicine? Those things kind of get looked at, swept under the rug. So when I woke up, I actually flipped it. And those are the first things I made sure I did. I made sure I got the workout in. I made sure I was, taking care of my mental health, making sure I was eating proper diet, all those things. And then when I was done with that, sure, I'd be tired and my willpower would be used up. But then I realized, hey, if I don't study, I'm not going to make it through medical school. So now you're forced to study, right? So you're kind of saving the things in the end that are must do because you know you have to do them. And that really helped me have an awesome balance between like work life.
So what kinds of skills are important for doctors to have that can't be learned in a classroom?
Yeah, I would say first and foremost, communication, learning how to speak, even nonverbal communication. And I think that's why I think undergrad is so important because, especially like a school like Wayne State, you guys are pretty big where you have frats and this and parties and you guys can go out or meet other people in clubs and all this stuff. That's very important to really just in college understand that verbal communication, becoming more socially intelligent, becoming more emotionally intelligent. Something you can't learn in a classroom, but something that will make the biggest difference when you talk to your patients. Being able to communicate effectively, clearly, and then just showing that compassion and empathy. And a lot of that comes through your nonverbal communication and the words that you say and the way you say it. I would say I think that's the number one quality that I think most like physicians need to learn.
So do you believe the extracurriculars like research, volunteering, etc., are really important for your medical school application?
Yeah, so it sucks because I guess like they are because you need it. The hours, the quality. So I would always focus on the quality more than the quantity. So if you can get like 20 shadowing hours, but you're seeing some awesome stuff, you're really learning, you're getting a great letter of recommendation out of it, it'll be better than 100 hours of shadowing where you're just not really doing much, you're not learning, you're seeing the same thing over and over again, right? But yeah, I do 100% believe just because how medical school apps are structured, that you have to have all those things. And that's why I say, don't be afraid to take a gap year and improve on any of those weaknesses that you may have in your application. For me, it was definitely the research aspects of things. So I took that gap year and really worked on my research.
So what are some common interview questions and what are good qualities to portray during your interview or through your personal statement and secondaries?
Sure. So let's start with, the interview. Common questions, obviously you're gonna get the why medicine. You're going to get asked about your CV. Hey, I saw you did research in this. Can you tell me more about it? What are the implications of this research? Is research something that you want to continue while you're here? You're going to get asked about why you chose the school. You're going to get asked about your weaknesses, your strengths. You're going to get asked also about your hobbies. I think, a lot of people forget to include their hobbies and their side passions. Medical schools want to get to know you, right? And they want to get to know your journey. So this is why, again, I come back to gap years because when you look at what medical school is, it's a journey of up and down, right? You're going to fail an exam or you're not going to do well. You're going to get burnt out, but then you're going to be you're also going to be on a high peak and you're going to do well, but then it's going to come back down. So it's this roller coaster ride. So in medical school admissions, I think really look for are those stories in applicants. And the best way you can get those stories is having gap years and putting yourself outside your comfort zone and pursuing those things. And that's exactly, I definitely had that type of story after, 4 years of undergrad, not making it through, and then doing this research, doing scribing, doing all these things, applying 3 times and finally getting in. So learning about grit and having grit, I think, is really storytelling. So those are things that they'll definitely ask you about. What I recommend is, one, don't be scripted, be structured. So what I mean by that is if I ask somebody why medicine, don't have an answer just scripted in your head. What I do for interviews is I come up with 3 bullet points for every answer in my head. So why PM&R? Okay, patients, the field itself is like art, and then the ability of functional medicine, right? So those are the 3 bullet points in my head. Now I'm going to come up with a genuine answer where I can weave those 3 bullet points together to make it more organic, more genuine. And I think it comes across better because some interviewers, they might not ask you why medicine. They might ask you, hey, what specific like thing made you choose this field, right? And that's asking the same question as why medicine. But what happens now is that the brain starts to stutter and say, wait, I don't have an answer prepared for this. But in reality, you do. It was the same answer for why medicine. But our brains trick ourselves and then we start to flutter. So that's why I really recommend having more of a structured rather than scripted approach. And just, having those bullet points in your head will make you, I think, a better speaker and also just more organic overall. Personal statement wise, real quick, I think it's the same thing. It's about digging into your why. And I think too often I'm a coach, I'm a pre-med coach, I read personal statements and stuff. I see too many people leaving it too shallow. Their why is too shallow. It's a very organic, or it's a very inorganic why. It's very much like, oh, because I was interested in this, or I saw a patient that did this or this, right? But why did that make you want to choose medicine, right? So you got to keep peeling the layers of the onion. So there's this exercise that it's actually called 7 layers deep. So you ask yourself why. So why medicine? First thing that pops into your head, I want to help people. Okay, cool. Well, why do you want to help people? Level 2. I want to help people because when I was younger, blah, blah, blah. Okay, cool. Well, when you were younger, why that? Okay, well, my parents, there's a mentor. I never had one growing up. Okay, well, why does a mentor matter to you? What's the next level? So you want to keep going down until you're really to the point of 4 or 5 levels deep. And that is what your personal statement should be on. That is exactly what, readers want to read, is your truest, deepest why. And then you can talk about for a little bit, oh, I shadowed here and I had this. People don't care about that because it's already in your CV. It's already in your application. What I would rather read about is something that's nowhere on your CV, but something that you can really share about yourself. And that makes me think that, hey, you really thought about why you want to go into this field.
Is there something you should really avoid writing in your personal statement?
Honestly, I don't think there's anything so there's red flags, right, that you can definitely avoid. I would honestly avoid writing about that one grade or the Mcat. A lot of people say, oh, if you messed up somewhere, you can include that into your application. You can always include that into your secondary application. You can always say that in an interview. I think a personal statement should really just be, it should be edgy, it should be you, and it should be something that makes me question a little bit. And maybe it's not going to vibe with every single admission officer that reads it, but that's okay. You're shooting your shot and you're pretty much putting yourself out there. But I wouldn't say there's anything, obviously you want to avoid politics. You want to avoid very of those extreme polar, abortion topics like that. I think you really just want to avoid. That can definitely be a red flag thing.
So are there any important things to keep in mind about interacting with patients?
Yeah, so again, I think first and foremost is making sure you're individualizing treatment for your patient. Remember that your patient is a whole unit, right? Mind, body, spirit, honestly. And really taking the time to listen to them. It can be very tough in the medical field to take time and listen because you're so rushed. You don't have much time to listen. You have so much on your mind. You have to get done these notes. You're worried about your presentation. You're worried about you looking bad when you present, right? So it's really funny because we try to be as selfless as possible. But honestly, we become very selfish as residents because it's all about our learning experience and how we look and all these things. But it's always important to just take a moment, be in the present moment, and realize what you're doing this for. And that's actually treating the patient in front of you, right? It's mainly for them. And so I think that's the most important thing. And so there's a book called Attending. I don't know, here it is. This is a really good book that I recommend if you guys are interested in this whole patient interaction. So Ronald Epstein, it's called Attending, but it's all about how to be mindful in medicine. How do you avoid burnout? How do you engage with your patients? And the biggest thing is, sure, it might take an extra 15, 20 minutes in that first interaction just to really figure out the patient. But that's going to save you so much more time down the road. So that's one thing that I'm really trying to put more into practice.
So someone asked, do you think it's manageable to be married and grow a family while in med school / residency?
Yeah, no, it's definitely possible. And this is what I always tell people is you cannot compare yourself. And the biggest trap in med school is everyone trying to compare themselves to everyone else, the smartest kid in the class, the most, one that has the best balance, all this stuff. Everyone has their own situation. There are plenty of med school, med students and residents that are married and grow up. I'm married currently. I just got married to my wife this year. But we did a long distance. Where she was in Boston, I was in Virginia. So it's definitely possible. You just have to remember, like, don't compare yourself and focus on your life as it is. And that's it. And it will definitely be manageable. Sure, some things are gonna be tougher than others, but that's just, everyone's gonna have their own, kind of things that they gotta deal with, so.
So what is your greatest advice to pre-med students striving to succeed in medicine?
Yeah, it's live in that gray area. Don't be afraid to live in the gray area. Even me currently as a resident physician, I'm currently living in that gray area thinking, always thinking, is this what I want to do? How can I become better? What are some things that would make my life easier? What are some things that I want to let go of? What are some things that I want to add? Right? And it's not saying, hey, I don't like medicine. It's how can I improve it? How can I make it better for me, my family, my colleagues, everyone else? And it all starts with you trying to become 1% better every day with your lifestyle, with your mindset, everything. So don't be afraid to live on the edge. Don't be afraid to do things differently. When everyone goes right, go left. And there's a lot that you're going to learn about yourself throughout this process. Enjoy the journey. Don't make your end game med school. Don't make your end game becoming a doctor. That is not the end game. Your end game is to live the best life that you want, right? That's what we all want. And being a doctor is part of that. So just keep that in mind. I think that's the biggest thing that I wish somebody told me going through the process.
So being a resident, how much did COVID-19 impact your workplace life and schedule?
Yeah, so luckily it didn't. I don't have to deal with COVID patients myself here at Penn State. I do treat COVID patients. I've had a couple, but I didn't have to actually go and see them. That's what the attending would do. But the way it's affected is that it's tough to wear a mask in the hospital and like not know who people are, not being able to like shake or touch your patients and have more of that kind of like or meaningful interaction. I think it's tougher in more of the social aspects of things. But I'd say that's probably the biggest thing is that it's tough in the sense that you're not getting the full experience as you would as a resident otherwise.
So someone asked, how did you personally balance your life and studying while you were in med school?
Yeah, I definitely had time for hobbies and going out. And again, like for me, the biggest thing was focus on my side passions first and foremost, because that makes me who I am. I'm known as this person that, I want to be a jack of all trades. I want to engage in life, not just in medicine, but all over. And then taking those things that I learned and bring them back into my craft, which is medicine. So I really focused on those things first. And then I made sure to study, but my goal wasn't to become like a 4.0 in a 4.0. It wasn't to get a 280 on boards, because I don't think those things are going to make you the best doctor. I think what makes you the best doctor is you living life on your terms and understanding what are those things that you need so that you're happy. And that's what those things were. I knew I could get a 4.0. It wasn't going to make me happy. What was going to make me happy was at least not being burnt out in med school and just enjoying life. So yeah, I definitely did have time to go out and do all those things.
So someone asked if you could talk about your podcast again.
Yeah, so it's on, you said, where can I find it? It's on Spotify or it's on Apple. It's called Optimize Your Life. You can also go to my Instagram at dr.darsh, doctor spelled out, and just click on my link tree and you'll see my newsletter. You'll see links for Apple and Spotify for the podcast. But yeah, essentially it's pretty much me just interviewing people who are just experts in their field kind of, or experts in them trying to live their own life. And I just try to get what they do to optimize their life. What do they do? Is it morning routines? Is it books that they've read? Is it the way they think about certain things? So people that you guys may know, actually, I don't know if you guys follow Jake Goodman or Zach, MD Motivator on Instagram, but those are two of my friends that are actually going to be coming on to the podcast as well. But it's not a medicine podcast. It's just a podcast that's there to help you just try to live your best life.
So what was your study strategy for the Mcat?
Yeah, so mine was, so I took it twice. The first time I didn't do too great because the verbal or CAR section was like really tough for me. So the first time I took it, I took like 3 to 4 months, studied for about 3 to 4 months. And then the second time I just took a month and a half, and I studied like 8 to 10 hours a day. So what I recommend to people is figuring out how you study best. Are you someone that needs 3 to 4 months, but then a little bit over time of studying? Or are you someone who's like, I need to get this done in a month and a half, and I'm just going to study my butt off for like 8 to 10 hours. I'm more of the 8 to 10 hours, just get it done with and take it. So really just understand that. The other thing I would say is take as many like full-length practice exams that you can. Like I'm talking about like 15 to 20. I think way too many people like undertake their like number of it. They only take like 3 or 4 full length. I really think the best way to attack the MCAT and make sure you're getting the best score is 1, doing a baseline exam, seeing where you are. Keep practicing until you plateau. But once you plateau, you have to break that plateau. And breaking plateaus are so hard, but it's just constant practice over and over, question, question, question. So once you break that plateau, then you're good. That's when you take your exam. So you have to make sure you break through that first plateau.
So how do you approach patients that are difficult to communicate with, like patients that are consistently straying away from treatment plans or not open to talking about their symptoms?
Yeah, this is huge. Had a patient the other day that just didn't want to be in the hospital, was in like septic shock almost, and just like kept cursing me out and all that. And I think you just have to understand, like, why is it that they're angry? Why is it that they're not doing the things that they need to do? And really just sometimes these people just want to be heard out. They just want somebody to listen. So I let them, say everything they need to say to me, but I also question everything about them, right? So I give them questions. The way I teach and the way I do things is very like Socratic method. I'll ask them, oh, well, why do you think you need to leave? Oh, well, what will you do if you leave from here? Why do you think this is helping you? So you want them to formulate their own answers so that they're like, oh yeah, well, I can't really say the other thing because they'll contradict what I'm saying now. So it really comes down to just understanding the patient, listening, and then making them come up with the correct answer themselves. But that's done through questioning.
Okay, awesome. I think that concludes the session. Unless anybody has any questions, you can unmute yourselves now or post it in the chat.
Absolutely. And if you guys have any more questions, feel free to DM me on Instagram. I'm super active there. I respond to everybody. So even if you just want to start, like, if you just want to say hi and stuff, we can always start a chat up. Always happy to connect with people, help you guys out in any personal way that you guys need. I'm also a pre-med coach, so I do kind of run my own program. So just message me about that and we can definitely talk about it. So hopefully give you guys some good perspective here, some value. I'm hoping it's a little different than, off the beaten road a little bit here. So that's my goal, is to try to be as realistic as possible with you guys. So
thank you so much. This session was so insightful and motivating, and I hope to have a session with you again in the future. To our Wayne State University students, please make sure you complete the Google survey posted in our Zoom chat soon, summarizing the session to obtain your shadow hours. And thank you all for attending, and I hope you guys all have a great night.
Cool. Thanks for having me, guys. Appreciate it.
The Google form link that was sent says it's no longer accepting responses.
Yeah, I see that too. Give me one sec.
We're opening it right now. Sorry.
Thank you.